One of the most common things that we get into our office is issues with discs. Okay, people come in for low back pain, they think it's sciatica that's running down their leg, but what's the root cause of the problem? And a lot of the time, it's going to be an issue with the disc. Now, what is the disc? You probably hear of a herniation disc or a bulging disc, but what does it actually mean? When we take a look at the low back, we need to look at the structures. Okay, what is the actual anatomy? Well, first we have the bones. Okay, those are what we call vertebrae, and the spaces between the bones are the disc. It's that sponginess that's there. Okay, and then on from the side, that's where the nerves exit from. Well, whenever there's pressure on that nerve, that's when we're going to have pain. And it can be caused from, well, first, the disc is too small, and so that's what we call degeneration, or the disc is swollen. Okay, this can come from any injuries or anything like that, but a lot of the time of what we want to do is we want to be preventative. How do we make sure that we don't have pain in the first place? Well, the first thing that I really want to talk about is improving our posture. A lot of the time people will walk around and they're just bent over like this, or they have too much of a curve into their low back. How do we prevent that from happening? Well, we have to look at our daily habits. Okay, what is our posture when we're driving? What is our posture when we're sleeping? What is our posture when we're sitting? And just working on those things and noticing, hey, if I have poor posture, working on correcting it, getting our chin back, getting our shoulders back where they're supposed to be, and standing up straighter can have a really big difference, especially if we're having disc issues. Now, some of those exercises can be chin tucks, some of them can be scapular retractions, but there's other things that I'm really going to go over that are going to help specifically with the discs in the low back. Let's go over some stretches. What are some stretches that we can do that are really helpful for the low back? Well, first, one of them is going to be something that we call a figure four. If you just lay down on your back, you're going to take one ankle, put it on the opposite knee. You're going to grab underneath on that thigh, and you're just going to hold and stretch. Okay, right here, what this is going to do is this is going to take a lot of pressure off of that low back by stretching the hip. Okay, we're going to hold this for about 2 minutes. Okay, another thing that you can really do specifically for the low back is just grab the knees and hold. This is going to help kind of decompress that low back and take pressure off of those disc spaces if you're in an active spasm, or if there's anything going on with those disc spaces and they're kind of degenerating. Another thing that you can do is if you just flip over onto your stomach, right? You lay flat on your stomach, you can go into kind of a cobra. Now you can just go into here, onto the elbows, or you can go all the way up into the hands, and this is going to help as well. This is going to help stretch all those muscles into the front and help with the muscles into the low back. Now, certain exercises, right? Exercises that can actually help with this. For one, the biggest thing that whenever you're doing exercises to strengthen the low back is you have to stabilize the core, okay? And so you have to tighten the core before you really do anything, especially when you're lifting. Now, one thing I tell people to do, and if you don't know this, I coached CrossFit for about 4 years, but that was before I went to doctorate school. Now, one thing that I tell people to do is really squat into a corner. So if you take a foot and put it into the corner and a foot into the corner here, and I'm right here, I can't squat forward. I can't hit my head against the wall. And so what we want to do is make sure that we have good squatting form all the way up and all the way down. And you can kind of tell I'm not leaning forward, I'm not leaning back. My upper body is staying the same, and everything is just coming from my thighs. That's another helpful thing that you can really do in order to help with any of those disc spaces. If they're inflamed, if they're degenerating, just be really careful with that. Now, if you have any questions or you have these concerns, please just reach out to us at Core Chiropractic. We would be really happy to help you with any of your problems. Thank you.